Brian said, I'm the pharmacist from Farmbrook Pharmacy. I know a lot of you. I've been your pharmacist for many, many years. I'm going to talk about pain today, but we're going to talk about pain from the outside in. We're not going to talk about the pain pills. We're going to talk about topical items that go on your skin that stop pain. Why do we use topical items as opposed to medicine sometimes? Well, sometimes medicines give side effects. Sometimes there's interactions with other medications that you have to take. Sometimes it's just plain better to rub something on for a situation than it is to take a pill. A lot of these items you probably have seen in the grocery store, the pharmacy, Bengay, Theragesic, Icy Hot. They're all rubs that you rub on your ankle or your foot. They're basically rub on, and how they work basically is that the pain stimuli is coming through. When you rub something on your skin, these items, they cool the skin and then they make it warm. So it's basically kind of a cool, warm sensation that you're feeling. When that happens, believe it or not, it takes your mind off of the pain in your foot or your ankle. So it's kind of tricking your mind. It's not actually doing anything. Sometimes when you do rub these items on, and you're taking, let's say, Motrin or an anti-inflammatory, you're actually increasing the blood flow to that area physically, which gets the aspirin or the Motrin or whatever you're taking to that area. But most of these items, like the Theragesic, Bengay, Icy Hot, are basically kind of tricking your mind. It's playing the cool, warm game, and then the nerve stimuli isn't as strong going up to your brain. There's one item here, and it's called Aspercreme. I don't know if any of you use Aspercreme. That actually has aspirin in it. When you rub this on your arthritic hands or your foot or your elbow, the aspirin actually gets into the joint to a certain extent and therefore causes stopping the inflammation. Kind of like taking an aspirin, but putting the aspirin right on the spot that hurts. Now, why would you say that maybe I should ask my pharmacist if I use Aspercreme? Well, how many of you take Coumadin or warfarin? Okay. Right there, here's a simple thing that you'd pick up in the supermarket or the pharmacy and could have some type of drug reaction with what you're taking. So even though these things look very inert, not very important, they're in boxes that you can buy anywhere, it's very important to ask your pharmacist or your doctor, how can I put something on my skin, or should I put something on my skin? And talk about cold packs and ice bags. When do you use cold packs or ice packs? Well, you usually use cold packs and ice packs in a situation where you fall, you hurt your knee and it's starting to swell up. Right away you put a cold pack on it. The cold packs work in a completely different way. The cold packs actually send another nerve stimuli to the spinal cord, blocking the bad stimuli. So there's two stimuli. When I fall down and hit my foot, there's a pain stimuli coming up into my spinal cord, into my brain. When I put a cold pack on, there's another stimuli going through a different road, blocking that message into my spinal cord, into my brain. Anybody ever use Icy Hot or Fast Freeze or BioFreeze? BioFreeze? Okay. This is ice in a tube. You can put this in the freezer. It will not freeze, but it'll stay real cold. You put this on, it's like putting an ice bag with ice on your joint. That's why a lot of the therapists, physical therapists, use this type of BioFreeze for joint pain, arthritis, sore muscles. But you have to be careful when you use these, and these rubs too. When you put these on with your hands, you've got to wash your hands. You can't get in your eyes. Any of these rubs can irritate the mucous membranes in your mouth, in your ears. So you've got to be very careful when you use rubs, hot or cold, that after you're done with it, you wash your hands and don't touch any other parts of your body. Another kind of a cool therapeutic external use are the heat pads. Little pads that you put on your back or your knee or your, I've got one over here for the wrist. What happens when you put one of these on and you open the packet to air, there's a chemical reaction that goes on. It's dealing with iron crystals that oxidize. It gets into a little chemistry, but basically what happens is the iron molecules, when you open up the packet, start moving real fast, oxidizing, cause anything that moves fast with friction causes heat. These will last from 8 to 10 hours. And they'll warm the area and bring blood flow and stop pain by having it on your skin. You cannot reuse these because once the oxidation or the chemical reaction happens and it becomes hot and it cools off, then it's not going to, you can't put it in a microwave and reheat it. So these are one-time reusable. But they're very good, especially for someone that needs 8-hour continual slow therapy. These last from 8 hours, so your heat and your therapy and the massage that you're getting lasts for a good 8 hours. Okay. All right. Well, thank you for your attention.
You want to
Yes?
talk about the pre-packaging blister packs?
Oh, yeah. Just to. We also do packaging of medications, blister packs. These medications, if for some reason you're confused on all your medications and you don't want them in a bottle, but you want them set up in a cassette, we set up medications in a cassette, so it's everything is Monday through Saturdays through Sunday, different times of days. We set it up a couple different ways.
They're also dated by day.
Right. We also set it up, that's a weekly cassette. This is a monthly cassette where each of the medications have their own cards. And then it's just set up so, yeah, it makes it easy. I mean, a lot of you have medications, 10, 12 bottles, that gets pretty confusing. Some of you are lucky enough to have sons and daughters that come and do it for you. And that's a blessing. But some of us don't have, or have people out of state, or people that are too busy to really be able to do it. And we offer that as a service at Farmbrook Pharmacy.